Here at the International Alliance for the Prevention of AIDS, our mission is to prevent the global spread of HIV through education and volunteerism.
Eric and I started this organization because we both met while volunteering with another organization in Tanzania, where we saw the impact, we saw the effect of what passion and time that you have as a student can do with people who really needed it. So we were able to see the effect of education prevention on the ground. It's powerful. Anybody who comes and sees what we do can kind of really experience that power. And it drove us to kind of do this in a better way, in a different way, in India as well.
When you have HIV nowadays, you can have a normal life expectancy. You just have to take care of yourself. More important, I think you have to take care of your loved one too, by being on medications, getting your viral load to undetectable so you don't transmit the virus to your loved one.
When I was 9 years old, my mom was diagnosed with AIDS, and I was the only one around to help her at the time. Luckily, she met a man who became the man I call my dad, and he helped us really learn how to live with HIV. My mom started her HIV meds and then was diagnosed with cancer shortly thereafter, and it became a part of who I am and became a part of my childhood.
The important thing that I think for Arizonans and for Phoenix and the folks involved with all the various AIDS service organizations is really twofold. Number one, follow the science. Look at what the science is saying about HIV and about the progression of the disease and about the state of the disease within your particular cohort. Number two, it's be culturally competent. You should have programs and awareness and activities that are relevant to the populations that are impacted in your particular area. So in San Francisco, where 90-some% of the new infections and the overall HIV population are gay and bisexual men, you had to be really focused on that community. In Arizona, that's probably different, so you need to focus on those communities as well. So follow the science and be culturally competent are probably two of the most important things any community must do with regard to ending the epidemic and eliminating new infections and ensuring people can live healthy even if they have HIV.
Yeah, I'm really excited. From many years ago now, I can look forward to a day without HIV, and it's within our reach.
The one thing that we know about dealing with HIV, there is no one thing. We have to be working on a multitude of platforms at the same time with various cohorts, various constituencies, various methods to drop the rate of new infections, increase the number of people who are taking PrEP so that we can move toward that day when we have 0 deaths, 0 new infections, and 0 stigma with regard to HIV in our community.
Stigma, it's always been the problem. People see stigma, or rather they see HIV and the stigma associated with it and how they first learned about it. That's not what it is anymore. HIV is everywhere, and it affects people we love in every situation.
We have trained many students to go to India over the past more than 10 years. We trained over 100,000 local students there how not to get HIV. And now we have the same opportunity to do the exact same work in Phoenix.
So the important thing to do, and what you want to do, is you want to increase the number of people who are virally suppressed in your community, right? And so they cannot transmit the virus. And you want to increase the number of people who are on PrEP so they cannot accept the virus, even if they do come in contact with it. The confluence of those two things will drop the number of new infections in your community. The overall community will live healthier, will live longer, and you move toward a state where HIV is no more. We're not there yet in this country. We're certainly not there yet in Arizona. But all the activity of this organization and other AIDS service organizations combined will help us get us there. And being a fast-track city, the 62nd fast-track city in the world, is very important because that says we're committed. Our local government people are committed, our health providers are committed, the overall community is committed, certainly the gay and bisexual male community is committed, and all of those people being committed together will help Arizona reach the day when there are no new infections.
The people who are going to change the landscape of HIV and the work we do are the people in this room, because you are the people who are coming back and supporting us, and you're the people who realize that it's not a one-time thing. if I wanted to leave you all with a message, it would be that we are closer than ever to really trying to end this.
We need your financial support, but I think we also need your effort to join us, to join the community, to end the disease. It's very important to go out and educate people about HIV. It's something we have to talk about. People still think it's a stigma, but if we don't talk about it, it's not going to go anywhere.
Your decisions and your actions have impacts, large impacts on other people besides yourself. And so keep in mind that when you're keeping yourself safe, you're keeping your friends, your family, and your community safe as well.
HIV doesn't discriminate, people do. And we need to remember that.
IAPA is important because it's addressing the concern with a particular cohort. And the work that's been done overseas, particularly in India, has been transformative. The question really now is, can we take that mindset of being transformative and can we make it local? Can we bring it back to Phoenix, where infections are on the rise among young people, where infections are on the rise among people who are not gay and bisexual men? And so all of that together will require the focus of IAPA and other organizations to, again, get people who are positive staying in treatment and people who are negative taking PrEP if they desire to take PrEP, so we can lower the rate of new infections and move toward a day when there are no new infections of HIV and a very healthy HIV positive population.
Most important thing is we have your support here. I think if we can come together and work hard together, we can do it.